As we age, our bodies change in ways that can sometimes feel unfamiliar or even alarming. A forgetful moment, a twinge of discomfort, or a blurry morning vision. Do these mean something serious is wrong? More often than not, these are simply natural signs of aging, not illnesses. However, these changes can easily be misunderstood. Many people rush to doctors, seeking treatments for conditions that don't necessarily require intervention. Overdiagnosis and overtreatment can lead to unnecessary stress, medications, and procedures, which might do more harm than good. Today, we'll discuss 5 conditions often mistaken for diseases, but are actually natural parts of growing older. By recognizing these signs for what they are, you can focus on what truly matters: staying active, maintaining a positive mindset, and enjoying a fulfilling life. Memory decline, a common concern. Have you ever walked into a room and forgotten why you went there? Or misplaced your glasses only to find them later in a place you swear you already checked? For many, these moments of forgetfulness spark fears of dementia or other serious conditions. But let's take a step back. Memory decline is one of the most common concerns associated with aging, but it doesn't always mean there's something wrong. As we grow older, the brain's ability to store and retrieve information changes. Neurons, the cells responsible for transmitting signals in the brain, decrease in number over time. However, this doesn't mean your brain is failing. It simply works a little differently. Think of your brain like a vast filing cabinet. Over the years, it fills up with experiences, knowledge, and memories. Retrieving a specific piece of information from this crowded system might take longer, but that doesn't mean it's lost. The good news is that there are simple, effective ways to keep your memory sharp. Stay mentally active. Activities like solving puzzles, reading, or learning new hobbies stimulate your brain and help maintain its flexibility. Physical exercise matters. Regular movement, such as walking or yoga, improves blood circulation to the brain, boosting cognitive health. Maintain social connections. Conversations and interactions with others keep your mind engaged and responsive. It's important to differentiate between occasional forgetfulness and serious memory conditions like Alzheimer's disease. While the latter involves a significant decline in cognitive function, age-related memory lapses are usually mild and manageable. If you're concerned, speak to a doctor, but don't jump to conclusions. Often, these changes are simply part of the natural rhythm of life. Prostate enlargement, a natural process. For men, prostate enlargement is a topic of concern that often causes unnecessary anxiety. The truth is, as men age, their prostate naturally grows larger. This condition, known as benign prostatic hyperplasia, BPH, is extremely common and rarely life-threatening. The prostate, a small gland that sits below the bladder, plays an essential role in urinary and reproductive health. Over time, hormonal changes in the body cause the gland to grow. This enlargement might result in symptoms such as a weaker urine stream, the need to urinate more often, or a sense of incomplete bladder emptying. However, it's essential to understand that these symptoms don't always indicate a serious problem. In fact, for most men, prostate enlargement progresses slowly and doesn't require aggressive treatment. Here's what you can do instead. Focus on diet. Foods like tomatoes, rich in lycopene and green vegetables support prostate health. Avoiding high-fat and heavily processed foods can also help reduce inflammation. Stay physically active. Regular exercise helps maintain healthy circulation and hormone levels, which in turn supports prostate function. Get regular check UPS. Routine doctor visits can ensure that any potential complications are identified early. It's also worth noting that overtreatment of BPH can sometimes lead to unnecessary side effects. Many men are prescribed medications or undergo procedures that may not be needed. By staying informed and working closely with your doctor, you can avoid these pitfalls. Blurred vision, natural changes in the eyes. Do you find yourself holding your phone farther away to read a message, or squinting to read the fine print on a bottle? These are common experiences for many people as they grow older. Often, the cause is presbyopia, a natural loss of the eye's ability to focus on close objects. Our eyes work like cameras, with a lens inside that adjusts to bring objects into focus. Over time, this lens becomes less flexible, making it harder to shift focus, especially for nearby tasks. This process typically begins in our 40s and progresses gradually. Does this mean your eyesight is permanently compromised? Not at all. Presbyopia is easily managed with reading glasses or progressive lenses, which correct vision for both near and far distances. Maintaining overall eye health is equally important. Here are some tips to keep your vision sharp. Regular eye check UPS. Annual visits to an optometrist can catch potential issues early and ensure your prescription is up to date. Protect your eyes. Wearing sunglasses with UV protection and avoiding prolonged screen exposure reduces strain on your eyes. Eat for your vision. Foods rich in vitamins A, C, and E, as well as omega-3 fatty acids, help maintain healthy eyesight. It's crucial to understand the difference between presbyopia and more serious eye conditions like cataracts or glaucoma. While presbyopia is a normal part of aging, other conditions may require medical attention. If you're experiencing sudden changes in your vision, consult an eye care professional. Bone health and osteoporosis, a silent challenge. Let's talk about something that often goes unnoticed until it's too late: osteoporosis. As we age, our bones naturally lose density, becoming thinner and more fragile. This condition can lead to fractures, often from minor falls or even everyday activities. Osteoporosis is more common in women, particularly after menopause, but men aren't immune. The primary culprit? A gradual loss of calcium and other minerals in the bones, compounded by a decrease in the body's ability to produce new bone tissue. Preventing osteoporosis starts with understanding its risk factors and taking proactive steps to protect your bones. Calcium and vitamin D. These are essential for strong bones. Include dairy products, leafy greens, and fortified cereals in your diet, and get moderate sun exposure to boost vitamin D levels. Regular exercise. Weight-bearing exercises like walking, dancing, and light strength training help maintain bone density. Avoid smoking and excess alcohol. Both can weaken bones and increase the risk of fractures. By incorporating these habits into your routine, you can reduce the risk of osteoporosis and maintain your mobility and independence as you age. Aging is a natural part of life, yet it often feels like an unfamiliar and unwelcome visitor. Changes in memory, vision, and mobility can seem like red flags of serious illness. But what if these shifts were just signs of a body adapting to the passage of time? Today, we'll uncover 5 common conditions that many mistake for diseases, but are, in fact, normal aspects of aging. By learning to recognize these signs for what they are, you can avoid unnecessary worry and focus on embracing a vibrant, healthy life. Together, let's reframe the way we think about aging, not as something to fear, but as a journey of growth and understanding. Memory decline, a natural adjustment. Do you ever forget why you entered a room or misplace your keys for the 3rd time this week? These small lapses can feel concerning, but for most people, they are simply signs of natural memory decline, not dementia or cognitive failure. As we age, the brain undergoes subtle but important changes. Neurons, the cells responsible for transmitting signals, decrease in number. This doesn't mean the brain is failing. It's simply adapting. Think of it like a library filled with books. The information is still there, but it might take a little longer to locate the specific book you're looking for. To keep your brain active and resilient, consider these tips. Exercise your mind. Reading, solving puzzles, or taking up a new hobby stimulates neural pathways and strengthens cognitive function. Move your body. Regular physical exercise improves blood flow to the brain, supporting memory and focus. Prioritize rest. A good night's sleep allows your brain to consolidate memories and recharge for the day ahead. Occasional forgetfulness is not a cause for alarm. Instead, it's a reminder to treat your mind like any other part of your body, with care and attention. Prostate enlargement. What it really means. For men, prostate health is a common concern as they age. Prostate enlargement, also known as benign prostatic hyperplasia, BPH, often causes unnecessary worry. But let's clear this up. BPH is a natural process and rarely indicates a serious issue. The prostate gland, located just below the bladder, grows slowly over time due to hormonal changes. For many men, this enlargement doesn't lead to severe symptoms. At most, it may cause mild urinary issues, such as needing to urinate more frequently or a weaker stream. Here's what you can do to maintain prostate health. Eat prostate-friendly foods. Tomatoes, rich in lycopene and other antioxidant-rich foods, help support the gland's function. Stay active. Regular exercise helps maintain hormonal balance and reduces inflammation. Consult your doctor. Regular checkups ensure that any concerns are addressed early and appropriately. It's important to avoid overtreatment, as unnecessary procedures can sometimes cause more harm than good. By focusing on healthy habits and monitoring your condition, you can manage prostate health with confidence. Blurred vision. The reality of presbyopia. As you age, have you noticed the text on your phone screen becoming harder to read? Or found yourself holding menus farther away to see clearly? This is likely due to presbyopia, a natural condition caused by the gradual stiffening of the lens in your eye. The lens, once flexible and able to adjust focus for both near and far distances, loses its elasticity over time. This makes it harder to see objects up close. While presbyopia is an inevitable part of aging, it's easily manageable. Here's how you can maintain your eye health. Get regular eye exams. An optometrist can ensure your prescription is up to date and catch any other issues early. Use the right tools. Reading glasses or progressive lenses can help you focus on close tasks without strain. Protect your eyes. Wear sunglasses to block harmful UV rays and minimize exposure to screens to reduce strain. Presbyopia isn't a sign of failing health. It's simply your eyes adjusting to a new phase of life. With the right care, you can continue to enjoy clear vision for years to come. Bone health and osteoporosis. Let's talk about a condition that often goes unnoticed until it's too late. Osteoporosis. This silent disease occurs when bones lose density and become brittle, increasing the risk of fractures. As we age, the body's ability to replenish bone mass slows, leading to a gradual loss of strength. Women, especially after menopause, are at a higher risk due to hormonal changes, but men can also be affected. To protect your bones, consider these proactive steps. Boost calcium intake. Dairy products, leafy greens, and fortified foods are excellent sources of calcium. Soak up vitamin D. Spend time in the sun or take supplements to help your body absorb calcium. Stay active. Weight-bearing exercises like walking or strength training stimulate bone growth and maintenance. Even if osteoporosis has already set in, it's not too late. Medications, along with proper nutrition and physical therapy, can improve bone density and reduce the risk of fractures. Every effort you make today contributes to stronger, healthier bones tomorrow. Joint pain, not always arthritis. Stiff knees, sore hips, and aching fingers are common complaints among older adults. But joint pain doesn't always mean arthritis. Often, it's simply the result of natural wear and tear. Over time, the cartilage that cushions your joints begins to thin, and the fluids that help them move smoothly decrease. This can lead to discomfort, especially after periods of inactivity or during cold weather. To keep your joints healthy and reduce pain, stay active. Low-impact activities like swimming, yoga, or walking keep joints flexible without adding stress. Eat anti-inflammatory foods. Omega-3s from fish, nuts, and seeds can help reduce swelling and pain. Maintain a healthy weight. Extra pounds put unnecessary pressure on your joints, accelerating wear and tear. If joint pain persists, a doctor can help rule out conditions like osteoarthritis. But for most people, small lifestyle adjustments can make a big difference in maintaining joint health and mobility. Aging is a journey of discovery, filled with moments of growth and change. By understanding these signs, whether in memory, vision, or mobility, you can navigate the stage of life with wisdom and grace. Instead of fearing these changes, embrace them as reminders of the resilience and adaptability of your body. Thank you for joining us on this exploration. We'd love to hear your thoughts and comments. Have you experienced any of these changes? What strategies have helped you stay healthy and active as you age? Stay curious, stay active, and we'll see you next time.